Namaste. Now I am going to speak about cancer pain management, that is pain management in cancer patient. Most of the cancer patients, about 80 to 90% of the cancer patient, they do experience pain which is very severe at one or other stage of the disease process. The faculty for this topic is Dr. Anurag Agrawal. He is a leading pain physician in Ram Manohar Lohia Hospital, Lucknow. He has 25 publications to his credit, and his area of interest is interventional pain management and spine management. He is anesthesiologist by profession, and he is working as a pain physician and anesthesiologist as Ram Manohar Lohia Institute of Medical Science, Lucknow. Etiology of cancer pain. What causes cancer pain? Pain in cancer patient may be because of tumor. The tumor of cancer, suppose it is pressing on a viscera, on a nerve or on a tissue, then it can give pain. Second important cause is by cancer therapy. Cancer treatment itself can cause pain, like patient having operation, undergoing surgery for cancer can have post-operative pain. If patient is on chemotherapy, some of the chemotherapy drug gives him pain. If he is undergoing radiation, that is radiotherapy for his cancer treatment, he can have pain. So, cancer treatment itself is also painful, and some type of pain which is not related to cancer is also experienced by the patient. Like patient had old arthritis or cervical spine problem, shoulder stiffness, they can have pain which is not related to cancer. Cancer pain, again it can be classified into somatic, that is because of the bone metastasis, visceral pain when it is into the any of the organ like pancreas, in liver, then patient can experience severe pain in abdomen, that is visceral pain. Neuropathic pain, when the cancer or any inflammation is pressing on the nerves or nervous tissue in the body, it can give pain. Sympathetically mediated pain, that is reflex sympathetic dystrophy, when the cancer or any tissue involving the sympathetic nervous system, it can cause different type of pain which is called sympathetic pain. Cancer pain can be of two types: baseline pain or continuous, some constant pain patient will experience throughout 12 hours or 24 hours, that is called baseline pain. But intermittently this pain will increase suddenly. Suppose a patient has cancer in spine, he is lying down, he is taking rest, he is having some baseline pain, but suddenly if he gets up from the bed, because of the cancer in the spine, he will get severe pain. This is called breakthrough pain. There is a transient increase in the pain to greater than moderate intensity above the baseline pain, it is called breakthrough pain. So, these are two types of pain you have to control. What can we do? Only sympathy? No. The answer is no. You have to do much more than this to relieve this pain, because this cancer pain is not a mild pain like headache or some joint pain we get in our day to day life. These patients suffer moderate to severe pain which they cannot tolerate, and it affects their quality of life if not treated. So, you have to work for this and to relieve the patient of the pain, otherwise it can have very serious consequences, and up to the and patient might get depression and even suicidal tendency. First of all, you have to assess the pain, how much is the pain. Unless you know the amount of pain patient is suffering, you cannot decide about the drug you want to use or the dose of the drug you want to give to this patient. So, there are many assessment scales, and from this scale you have to measure the intensity of the pain, how much distress patient is getting because of pain, what relieves the pain, and what is the breakthrough pain patient is having, and what is the doses. The scales which are available to assess the pain is numeric rating scale, visual analog scale, and descriptive. Aim of cancer pain management is to optimize the pain control, to minimize the side effect of the drug which you are giving to patient for pain management, and to enhance the functional ability. Patient should be able to perform his day-to-day activity better after you treat the cancer pain, and even psychological well-being should improve once the pain is controlled. And overall final aim is to enhance quality of life of this patient. What are the treatment options available for cancer pain management? First is pharmacological approach, means by giving drug, by giving medicine. Second is interventional pain management, means you are injecting some agent into the nervous tissue which is causing pain. They are called blocks or neurolytic blocks. Third is neurosurgical intervention. You can do some surgical procedure on this nervous tissue or on these nerves, and patient will get pain relief. Third is long term epidural or implantable pump. On our back there are vertebra, inside that there is a spinal cord, and this spinal cord is covered by layers. If you inject a drug between these two layers, which is called epidural, then that will numb the nerves which are coming out from the spinal cord, and it will give pain relief. So, long term epidural injections, or by putting a pump over there with medicine in that pump, patient can get pain relief. There are few other techniques by which cancer patient can get relief is TANS, acupuncture or hypnotherapy. The simplest way of treating cancer pain is by WHO 3-step ladder. There is a separate lecture on this also, which I will be talking after this. WHO has simplified the way how you should give medicine, pain management medicine in cancer patient by putting them in 3 different categories: step 1, step 2 and step 3. So, in step 1 there are simple medicine. In step 2, when the pain increases, you have add more potential drugs, and step 3 you will be using morphine, that is a very potent analgesic, very good drug to relieve cancer pain. The morphine which we use for patient cancer pain management or for cancer patient, they are called opioids. These narcotic drugs are called opioids, and these opioids can be of 3 types: weak opioids, that is tramadol and codeine; synthetic opioid, that is fentanyl, which is available in injection form and in form of a patch to be applied on the skin; And naturally occurring opioids are morphine. Morphine can be cultivated, and methadone. Or oral morphine is a gold standard of the treatment for cancer pain management, and this is the subject of advocacy for patient right to get the relief treatment of the pain, to get relief from the pain. There is a many issues surrounding this morphine availability in India, and we are trying our best to solve these issues and make morphine available to all patients who needs cancer pain management. Another drug is fentanyl, very costly. The transdermal patch is available to be put on the skin, but it is very costly, expensive, very few people can afford. But it should be used when the patient is not able to take morphine by mouth, he cannot swallow, like head and neck cancer patient. They say at some stage there is no feeding tube in this patient and they are not able to swallow the medicine, then these patches are very useful. This is the picture of the patch. It can be applied on dry skin, should be applied on dry non-hairy skin, like on the arm, on the front side of the chest, on the back or on the thigh. As per WHO guideline, cancer pain can be managed by all medicine which is given by mouth. That is so, it is a WHO 3-step ladder using only oral analgesics or oral medicine for pain management. So, this medicine should be given by mouth, it should be given round the clock. When you say the tramadol is given 8 hourly, means every 8 hour the drug should be given. Morphine is given 4 hourly, means every 4 hour the tablet should be given exactly by the clock. It is not that whenever patient gets pain and he pops up a pill in his mouth and swallows it, it is not like that. There is a system of giving it round the clock. By the ladder, step 1 for the mild pain, step 2 drugs for the moderate pain and step 3 drug for the severe pain. For the individual, you have to individualize the treatment. Some of the cancer patient may not feel severe pain, so you need not give morphine, but few of the cancer patient may feel severe pain even if their disease is in stage 1 or not much spread. So, as per individual requirement, you have to choose the drug and its dosage. Attention to detail. After the starting the treatment, you have to follow up the patient, you have to find out whether he is taking it properly, what side effects he has, what are the other problems he has developed because of this treatment. By mouth, because this cancer patient will need pain medication for very long time, for many months or maybe years. So, it is not practical to give injections every time. So, it is better they take it by mouth, so they can be sent home and it can be managed at home by patient themselves or a caregiver or a family member. In some of the patient who are not able to swallow by mouth, there are rectal preparation available which is inserted through the rectum. It is always fixed time interval, as I said, then only it will give pain relief. If you wait for pain to reoccur, then give drug, then patient will be in so much of distress, he will be suffering and it will have its own consequences. By the ladder, as I said, in ladder there are 3 steps. Step 1 is for the mild pain and you use mild drugs. Step 2, it is for moderate pain and you use step 2 drugs like tramadol and codeine. In step 3, when patient has severe pain, you have to use morphine and fentanyl or methadone. Along with this drug, you have to give some other mild analgesics also to reduce swelling, inflammation, to minimize their side effect, like morphine causes constipation, then you along with that always give Dulcolex to relieve their constipation, like that. These are called adjuvant drugs, and adjuvant drugs are always necessary. As I said, you have to individualize the treatment. One patient may need only 5 milligram morphine, and another patient, his pain may not be relieved with 50 milligram morphine also. You have to also consider the what is the kidney function and liver function in this patient before starting or increasing the dose in this patient. So, individualize the treatment, and adjuvant drugs are very important, like some of the drugs causes gastritis, that is called, we in common terms we call acidity, like tramadol causes acidity and nausea, vomiting. So, along with that you have to give drug to control their nausea, vomiting or acidity. Again there is a classification of adjuvant drugs. So far we talk about baseline pain, now we are coming to the breakthrough pain. As I explained you earlier, the breakthrough pain occurs suddenly with the movement, with the getting up from the bed and like that. So, there is a continuous persistent pain at one level, and suddenly if patient gets up from the bed or he is having cough, then there is a sudden increase in the pain. This is called breakthrough pain, and there is a different way to treat this breakthrough pain. To treat the breakthrough pain, one can give a addition dose of the drug which he is already taking. Like if patient is taking 10 milligram morphine 4 hourly, and if he gets breakthrough pain, you can give another 10 milligram morphine to relieve that breakthrough pain. Breakthrough pain is sudden in onset, very intense, sometimes it is self limiting, like a cough will give pain, but it will subside after 5 to 10 minutes. Sometimes it is because of the patient has not taken the next dose in time, and sometimes it just occurs without any reason also. Another drug which has come into the market is oral transmucosal fentanyl. We call it fentanyl lollipop. Like lollipop, one has to chew this medicine. This is the medicine which is chewed by the patient. So, it is called fentanyl lollipop. It is very much used for the breakthrough pain, because it has got urgent effect, instant effect. So, if patient gets breakthrough pain, he just puts one lollipop in the mouth and his pain will be relieved. Of course, it is very costly drug. Action starts within 5 to 10 minutes and it remains up to 30 to 40 minutes. The dose, it contains 200 microgram of fentanyl. Whenever your patient is on opioids, that is narcotic drugs, as I said earlier, like morphine, you have to monitor whether patient is taking properly as per timing, as per dose, he is not taking unnecessarily extra dose, he is not misusing this medicine by giving it away to friends and family. All this monitoring is required. Secondly, you have to look for the side effect. Morphine causes severe constipation, and for that you have to advise the patient about the change in diet, change in lifestyle, increase water intake, taking Dulcolax at night or cremafine syrup like that. If patient does not have pain, slowly you can decrease the dose of the morphine and discontinue, and slowly you can withdraw. So, decrease 25% of the dose every time you want to decrease the dose or discontinue the morphine. In elderly people, morphine should be used very cautiously because it can give giddiness, sedation, retention of the urine. So, in elderly population, you should always minimize the dose by 20 to 25% than the adult dose, and slowly you can increase the dose. And particularly elderly population has fluctuating pain levels, and frequent breakthrough medication is required. If their pain is steady, you can use long acting drug also, which can be given 12-hourly. Many a time fentanyl patch is not given because of the excessive heat, because in presence of temperature, patient is having fever, then there will be excess absorption of the phentermine through the skin, and it can give higher blood level of the drug into the body. There are many misconceptions about cancer pain management. When we start morphine as a treatment of cancer pain in many patients, they refuse. They, no, keep this drug for the last time. They feel morphine is the drug to be given only when the cancer is in advanced stage or in last stage. It is not true. Sometimes your cancer tumor is at such a place that you may need morphine right at the first stage or right at the diagnosis, like cancer of the liver, and it has got a huge tumor into the liver. Patient will get severe pain right in the beginning. Second, there is a misconception that morphine causes respiratory depression, slowing of the breathing, and which is not good for the patient, but it is not so. When morphine is given in presence of pain, it does not slow down the breathing. It will give good feeling of well-being, and patient will have good pain relief. So, third is, people believe that I will take medicine only whenever I have pain. But as I said earlier, all pain medication, when it is given for the cancer pain management to cancer patient, it should be given round the clock as per the timing, and not when the pain appears. If you give like that, if on the pain on demand, then patient will be suffering, and it will take longer time to treat his pain. Whenever you are treating cancer pain, you have to evaluate the anxiety, depression, psychological problem of the patient, and that should be addressed by communication and counseling, because that may be the cause of pain in many of the patient. What if cancer pain is not treated? What will happen? All of you might have experienced that one of the day you might be having a severe headache, and if it is not relieved, in spite of that headache, you have to go to college, you have to attend a job, you have to do your routine work, you have to take your family out, then you are not happy. And many things happen, you may become irritated, you may become angry, you may take up quarrel with somebody, yeah, you may shout at your family members, you do not feel like eating. So, consequences of the cancer pain is also like that. If it is not treated, Patient will have poor appetite, weight loss, disturbed sleep, withdrawal from the social contact, relationship, sadness, anxiety, depression, and up to the level of committing suicide. As I said, physical and verbal aggression, wandering, acting out behavior, then they may refuse the treatment, they lose hope or trust on the doctors and nurses and they refuse the treatment. Difficulty walking on transferring and may become bed bound. So, these are the consequences if cancer pain is not relieved. Sometimes it severely affects the once become bed bound, he will develop skin ulcers, incontinence of the urine, increased risk for use of chemical and physical restraints. He is likely to use some other drugs and impaired that will decrease the immunity of the patient in if pain is not relieved and is likely to get some infection, some viral infection or bacterial infection. But cancer pain can be simply managed by WHO 3-step ladder, the drugs which is mentioned in the 3-step ladder, almost 95% of the patient can be managed with these drugs. Few patients who are fit to undergo this neurolytic block can be managed by injection of the neurolytic agent into the nerves, vicinity of the nerves and into the spinal cord. Thank you very much.